Hello everyone. Welcome back to my channel. This is your Farm D with the T. I wanted to come on here and discuss briefly a bit of news that I came across that really excites me. So it looks like there's a couple of tech giants, Apple and Amazon to be specific, who have decided to make moves in healthcare. We all, if you've been around for at least, a decade or two, you've seen basically the rise of smartphones. I still remember my very first phone was that it was like a block phone. It was that Nokia, hard as nails, a brick phone with the green screen, black text. You couldn't really do much on it but make a phone call. And I think I only had like 60 minutes a month on it. It was just for emergencies. And that was back when I was like maybe a senior in high school. So phones have come a long way from our original block Nokia phones to the smartphones that we have today, especially in the last decade. We are using these devices basically to, as this article points out, manage our daily lives. They really have become pocket computers to us, very convenient pocket computers. So it only makes sense that a tech company that has a large stake in these smartphones and then also can see our landscape when it comes to healthcare, more specifically healthcare expenditures and healthcare consumption, it would make sense that they would want to incorporate the use of their technology in healthcare. That's a pretty large market that they can tap into. The article says here Apple has spent 3 years preparing its devices and software to produce medical data, offering products to researchers and clinical care teams. On January 24th, it announced the results. The next big software update for its iPhone will include a feature, Health Records, to allow users to view, manage, and share their medical records. Embedded in Apple's Health app, the new feature will bring together medical data from participating hospitals and clinics. There are 12 of them as of right now, as well as from the iPhone itself, giving millions of Americans direct digital control of their own health information for the first time. This is great. You can have information about your health readily available at your fingertips. On January 30th, Amazon announced a partnership with Berkshire Hathaway and JP Morgan Chase to create a not-for-profit healthcare company for their own employees that promises to employ technology to provide cheaper care than conventional health insurers offer. I'll talk more so about Amazon and their endeavors into the healthcare system in another video. I'm going to focus more so on Apple in this video, but I just wanted you guys to see that a lot of these tech companies are stepping up to the plate. They're shaking things up in our healthcare systems. People have realized for a long time the way that we do things don't make sense. It creates a lot of waste. It is very expensive. It would only make sense that you would have leaders in technology, leaders in in producing what consumers want, what consumers need, would, you know, take a take a stab at it to see if they can do it better. Can they provide a service that's more efficient, that's more cost effective, that still delivers without reducing quality? It will enable users to transfer clinical data like their cholesterol levels and list of medications prescribed by their doctors directly from their medical providers to their iPhones, potentially streamlining how Americans gain access to some health information. Can you imagine, let's say, you're a patient with diabetes and you want to keep an accurate record of your blood sugar levels, your A1C, your glucose levels. You can have this all on your phone. So when you go and see your doctor or your other healthcare provider, maybe you see an endocrinologist, and then you're going to see your primary care doctor, and your primary care doctor would like to see your progress and how you're doing. You can just show them how you're doing on your phone. I think this is an amazing idea considering how fragmented our healthcare system is. You see a specialist for one thing, you see another provider for another. This is a good way of connecting it all, having a good overall general picture of your healthcare all in your phone. Also, as a pharmacist, I think this part right here, a list of medications prescribed for your doctors, that to me is extremely important because if you're seeing multiple providers and each one of them are prescribing medications, the potential for duplicate of therapy or the potential for drug interactions is there, especially if the other providers don't know what everyone else is prescribing you. So, again, I think this would be a wonderful tool. I think it will reduce some errors. Apple said it will not see consumers' medical data, which is encrypted and stored locally on the iPhone, unless the user chooses to share it with the company. That's also very, very important. Security, patient privacy, all of that are very important topics in healthcare. How do we secure our data? How do we protect the data of our patients, of ourselves? How do we keep it secure? We don't want it just being shared with just anyone. And Apple has built this level of trust with its consumers. um, People trust Apple when it comes to their data. And the fact that Apple is making a point so that people and consumers know that their medical data won't be seen by Apple unless Apple was given permission to see it. I think that's very, very important to note. So, right here is a screenshot of the health records within the health app. It even keeps track of your immunizations, which is great. It keeps track of your allergies, which is another great thing. I remember reading an article about this, and it was stating how this would be great for in cases of emergencies. What if in an emergency you have to be rushed to a hospital, to the ER? If you have this app and they're able to get into it or unlock your phone, especially if they're using a touch ID, they can find out information such as if you have any particular drug allergies, so they can avoid that in you. They can check out your medication list. They can see which pertinent health conditions you have that they should keep in mind as they're treating you, especially if there isn't a loved one available to explain these things to them. Anything could happen, but if that information is readily available in your phone in an app that can be easily accessible by healthcare professionals in an emergency setting, that would be very beneficial to the person that's in need who is unable to communicate those things to the healthcare provider in dire situations such as that. Now, keep in mind, this is not the first time that tech giants have thought about implementing this sort of idea or concept. It looks like in the past, um, Microsoft has also tried implementing this as well. And I believe Google had tried it in the past also, but it didn't fare too well. See right here. Apple's personal medical record features hardly a new idea. With much fanfare about a decade ago, both Google and Microsoft introduced free services called Google Health and Microsoft Health Vault that help consumers centralize their personal health data. But the concept of the personal medical record did not generate widespread adoption in that era, which predated the popularization of the iPhone and mobile apps. So Google ended up shutting down their Google Health in 2011, and Microsoft still offers the Health Vault service. Timing is everything. Now everyone does everything on their phone. Everyone, there's an app for everything. You know, one of the things people say, well, is there an app for that? And they'll download it to their phone. So now we're in the mindset of using apps that we find to be more convenient in our everyday lives. I like how the New York Times also explained that this isn't the only thing Apple has been doing. But recent product introductions like the new health records feature highlight how focused Apple is on using its iPhone, Apple Watch, and apps to give people more control over their health care. In addition, the iPhone Health app, Apple has developed research kit software to help researchers develop iPhone apps to conduct health studies. Right here, Becker's Hospital Review discusses a few of the hospitals that will be among the first to pilot Apple's medical records system. So, you want healthcare systems, hospitals, clinics to get on board with this so that patients can have access to that information through their phone, through their health app, so that it's all connected. If you see three doctors, but only one participates in the app, well, or allows the app to pull that data, well, then it's still going to be a bit fragmented. But if everyone is willing to communicate with each other through the app and it's all in one centralized location, that the app will serve a better purpose. It will serve the purpose it's trying to serve more precisely, more accurately, because it will be a deposit of information from multiple sources. So, in this article, they provide 6 things to know about the pilot program. Because Apple, they're going to do their research, they're going to do a pilot program before they roll it out completely, as they should do. Apple announces its intent on January 24th to integrate patient health records into its health app. Their health app is already out there, but now they're just taking it to another level to make it easier for consumers to review their medical data. iPhone users would need to download the 11.3 beta version of iOS to access the feature, according to the San Diego Union Tribune. While many hospitals and health systems already provide patient portals and other programs for patients to access their health information, Apple aims to embed patient data from multiple providers into the iPhone's main system. This deep integration function can help improve smartphone users' health by allowing patients to grant permission for other app developers to use the data to help provide the best deals on medications. That's Apple thinking outside the box. That's additional features that would be beneficial to patients. Other hospitals involved in the pilot program include Chicago-based Rush University Medical Center, Los Angeles-based Cedars-Sinai Medical Center, and Philadelphia-based Penn Medicine. So they're going after some well-known hospitals, okay, really big healthcare systems. Another one is this Geisinger Dignity Health. They are a huge healthcare system as well. and again, before Johns Hopkins Medicine, the hospitals that they chose to include in this pilot program they're no joke. They are renowned, well-known hospitals that do great things, big things. They are huge healthcare systems with hospitals and clinics that are associated with them. So these would be the type of hospitals you would want to include in your pilot program to see whether or not an app like this would be beneficial, or if it's even realistic, if the concept can be done in terms of linking all these medical records together and putting it in one app so that patients can easily view everything. That was my commentary on this bit of information that I came across with. I'm for it. I think it's a very great idea. I'm excited to see how everything plays out once it goes live, once it's out of beta mode, once it's available for everyone to start using. I'll probably provide some follow-up feedback once that happens, but let me know in the comments section below what your thoughts are on this matter. Are you concerned because maybe we're growing a little bit too dependent on our phones, or maybe you think it's a good idea because you have loved ones who you are concerned about that you can't be with all the time, and if anything were to happen to them, you like the idea of certain, not all, but maybe certain medical information being readily available through an app on their phone in the case that they do need medical care. Yeah, just let me know your thoughts in the comments section below, you guys. Again, I hope you enjoyed this video. Don't forget to like, share, and subscribe. Thanks for stopping by, you guys. I'll see you at my next upload.